So if you notice, the nose increases at a natural rate of 0.5 millimeter a year. A lot of people don't care about how much does the nose grow in width naturally. 0.5 millimeter a year, that's it. So 1 millimeter every 2 years, 2 millimeters every 4 years, 3 millimeters every 6 years. The whole palate is up. What would you guess she looks like in the frontal? Here she is in the frontal. See a bilateral crossbite? Look at the space inside the ramus for the upper molars. She's 7 years, 8 months. She has a nasal width of 25. Bilateral crossbite. We're going to put something in. We start splitting her palate. All this is new bone in here. Notice the width increase in her nose already. After we do that, we put a headgear on her. Move her maxillary teeth back. Here she is. After the adenoid's removed, you can see she still has a little space in here where was a mouth breather. Now she's got a chance of being better. Palate's up. We want to get this palate back around now. Here she was at rest. So that you can see there she's breathing through her mouth. Now we put her on a headgear. And we have to put her on a utility in the lower in order to get room to bring the palate down. So you see now the difference between that and what she was. Here's the palate here. Now here's the palate here. See the width of this nose now? And look at the width of the arch now. That's quite significant. Finished with a full strap up at this time. So 8 to 11 is 3 plus. How much natural increase would you have in her nose? 1.5 millimeters. So we've widened her nasal cavity 5 millimeters. How much width increase in the first permanent molar? 11 millimeters. So this is a patient now that had expansion. Here's a patient that's actively during a palatal split. You can see the palate is split and it's going off to one side. We found that there was 3 types of behavior here. One type, the most common type, is that this vomer sits in a groove between the 2 palatine shells, as we learned yesterday. And it'll separate here and separate here, leaving that wedge of the vomer sitting there. In some patients like this one, it will split on one side and the vomer will go with one side of the nose. Now in other patients, we had one patient, and when the split occurred, it split the vomer bone. The vomer bone had a little bit of a lamina in it, and just split right up the bone. So we've seen all 3 of those types of behavior. Here's another child with a double crossbite. And we put him in a quad helix. And you can see the nose increasing here too. Here's the quad helix. And if you notice, there's new bone forming right here. The reason that I like to expand in the upper arch with quad helix is that the bone will fill in at a rate of the movement. The other reason I like it is because the molars will rotate, and I can help correct a class 2 with it. Third reason is I can go in and intraorally adjust it. The fourth reason is because I don't have to trust the patient to wear it, to activate it. I can do it. The next reason is that it's cheaper. The 7th reason is it's cleaner. The 8th reason is I can take a diamond and remove it and then go into a headgear. So there's a number of reasons why I prefer the quad helix to the jack screw. So, kind of a little hierarchy here. Nasal width. lower molar width.
下顎大臼歯の径。
Inner canine width.
では犬歯間径。
The amount of space buccal to point J to this line.
それからこの狭側から J 点のスペース、この線までです。
Right and left.
右と左。
The distance of the molar buccal surface to this line. Right and left.
それから大臼歯の狭側面からこの線までの距離、右左。
Symmetry here of the denture and symmetry of the chin.
で、この
Remember yesterday or the day before, I said that biologically, whenever bone and muscle come into a conflict, that the muscle wins. Bone is there to take stress, but it's of an intermittent variety. But usually, continuous force on a bone doesn't exist. But muscle withstands gravity, and muscle tensions dominate the bone.
で、筋肉の張力により
The
まし
bone will remodel.
て、
If I break a bone,
もし
and the bone is approximated, set after a fracture. Now when this is done, the bone will heal. A callus will form. It's like you put some putty around the bone. It forms a callus around. It's sort of a homogeneous, just throwing bone in, sort of cementing it up temporarily.
で、まあ、
And from there then it goes ahead and remodels
でそこから先
ultimately to the place where you really may not even be able to identify that it was ever broken.
でどんどん
If I tear a muscle, or I cut a muscle,
あるいは
or I shred a muscle, that muscle will reorganize and it will come back and be functional.
で再生し
If I cut the blood supply, even an artery that's in a bone, it contracts down and a clot forms.
で血片が形成されて
Fibrinogen comes in and it gets stiff and it will heal up.
治癒します。
Collateral circulation will come in
そうする
and little arterioles will become arteries.
と
Little arteries become big ones
小さい
and healing will take place.
で治癒します。
So most of the tissues will heal. But if I cut the nerve and the nerve isn't replaced, the part will become atrophy or dystrophy
その部
and
分
it will wither and disappear. Now there are three divisions in the nerve supply. One is the neurosensory, one is the neuromotor,
関係
and the third is the neurovascular.
関連しています。
Nerves are classified as central and peripheral.
この
They're also classified in terms of their type.
中枢線
One type is the A type. It is the heavy, big nerve, such as the mandibular nerve coming out of the cranial valley. That is type A nerve.
でこれは
It is thick
非常
and
に
it's
太いです
myelinated,
し
and it carries impulses at relatively high rates.
でこういった信号
When you
で
get pain that is sharp, sticking or stabbing, it usually is one that is coming through the A fiber. The B fiber is also a large nerve, but it's non-insulated.
ない
B fibers usually go to the viscera. So the speed of that they transmit is somewhat less than the A fiber.
います。
The viscera are slower because they go to the gut, to the ovary, to the testes, to the organs, the kidney, the liver, and they're regulatory.
でこれは調節性のものです。
So they don't have to be real fast. The third fiber is the C fiber. But the C fiber is very thin and it's unmyelinated also.
やはり
The body is literally covered with C fibers.
で
The C fiber is a fiber that, for instance, goes to the bladder and tells you when you have to urinate.
で例え
And you all have had the uncomfortable feeling of when you have to go and the bathroom's closed. C fiber pain can be excruciating pain. A lot of the pain that we get in the face is C fiber pain. Particularly if it's broad pain that's coming from an area that you can't be specific where the pain's coming from. The C fiber pain, for instance, is the pain that you get when you put your hand in a bucket of ice water. At first you put it in, it's tolerable, but leave it in for a while, it gets very painful. This is the kind of pain some people have with TMJ disease. So we're talking about the nerve characteristics and the nature of the pain so that you know in the diagnosis the kind of pain. It gives you a clue as to what nerve is involved. Each neural cell body is like a tiny little transmitter. So it transmits the impulse because there's an energy there. So we know that the body is linked by an electrical system. But there's also some evidence that there are chemicals that pass through the synapse. Characteristically, a nerve is made up of a cell body with an axon or an axis and a dendrite. The impulse is picked up at a nerve ending where it's transmitted through the synapse. In the synapse there's a tiny pump, and this little pump will pump the chemicals and stir them up so that they be acted upon by the nerve endings. This is one way that the drug cocaine works. It affects the chemistry at the synapse. You all know that cocaine was used in dentistry prior to the derivatives of it, so it blocked impulses at the synapse. Sniffing cocaine gets it into the bloodstream, and the message then is distorted because it's not coming through loud and clear. So it gives the person a strange feeling, something that is not reality. And this becomes then a psychologic dependency. From what we know, however, heroin works in a different way. Now when the nerve cell functions normally, a polarization and depolarization takes place. Some of the potassium then changes, and the negative charge turns to a positive charge. And that's what causes the wave propagation. After the wave goes through, the process reverses, and the nerve comes back to a state of equilibrium. Now, when a person has heroin, the heroin ion replaces the potassium on the inside of the cell. This is more than a psychological dependency, this is a physical dependency. Imagine all of the organs of your body, all your muscles, all your brain and everything else not being able to function correctly. Now some of the other psychedelic drugs that we use, including marijuana, simply excite the cell body. And in fact, what happens with them is that if you get an overload or an overdose with them, you actually explode the cell body. I talked to a brain surgeon who operated on patients at Camarillo there in Southern California. And when he opened up the brain cavity, the brain had shrunk to half its normal size. Alcohol does the same thing. Damn it. Chronic high alcoholics will destroy their brain and their nervous system. But alcohol will also destroy neurons in the brain. Alcohol will also destroy muscle. So alcohol is really not that great. So we usually think of a transmitter of electrical nature. But some experiments have been done in which they took animals, isolated the lymph, isolated the blood supply to the heart, and injected certain types of neurotransmitting materials in the finger or in the claw. And they picked it up in the brain at the nucleus of the nerve that went to that part. Then they reversed the process by injecting the nucleus of the nerve in the brain, and they picked it up at the peripheral area. this meant then that the nervous system was also a sort of a circulatory system. Now there's another process in communication of the body to one part of the body to another. And that is an electrical charge will go directly through the tissue. It doesn't have to go through the nerve. This is one theory then of acupuncture with the systems of meridians. And it is another electrical system apparently in addition to the system that we have of our neural system because they do not run with the nerves. These acupuncture points have been known from the Orient for century after century. Now there is a great deal of work being done today in the field of electricity and magnetism. Electricity is a very funny thing. It can be described, but nobody's ever explained it. Something happens in the brain during hypnosis. There's an alteration of the electric phenomenon in the brain in hypnosis. It can be described, but it can't be explained. I don't know whether it's been translated into Japanese, but Robert Becker wrote a very interesting book that I read a year ago. It's entitled Cross Currents. He is the one that did a lot of the work in trying to get bones to heal. And like many innovators, he has a lot of enemies. He thinks there's a very important function for electricity in medicine. What he did was to try to determine what causes healing. When you receive a cut, a bruise, or a fracture, what are the physical processes then that determine what is going to take place in the healing process? I was very interested in this, still am very interested in this field, because it deals with growth. And we haven't really learned very much about controlling growth, have we? We certainly try to do it with physical means, such as putting braces on, but we really don't know much about the total processes of growth itself. One of his early experiments was in a frog, in which he cut the forelimb of a frog off. He then dissected out the sciatic nerve, which in the frog is a very big nerve. So what he did in this experiment was to take that sciatic nerve and empty it right at the site where the amputation had been done. So he took it out, he dissected it, kept it intact, and brought it up to supply the area. He reattached it. And what actually happened was that the limb started to regrow, even to the claws in the minutest detail. In other words, he had dedifferentiated the tissue at that local level. Remember, I talked the other day about epigenesis. Epigenesis was the differentiation of a cell that after it had gone so far it couldn't return. Now apparently with the amount of whatever the nerve juice was, whatever the stimulus was, it was capable of taking those local cells and reverse them to something that they were more primitively. Now from that then he began to put simply charges onto tissue with electrical fields. Instead of 6 weeks of bone formation, he was healing bones in 3 weeks. And has speculated that we are into an electromagnetic contamination today. We are sitting under electric lights. We have air coming through a vent that is passing over a fan. We have our automobiles charged very highly with electricity because there's a magneto in there that makes the charge. We have lights beside our beds with reading lamps, with a radio there. So we are literally surrounded with electrical phenomena, and the airways are literally saturated. There's hardly a wavelength that isn't used now with all the cellular radios that we have. And one of the first things to emerge, which is statistically significant, and nobody doubts it, is that people who live next to high-tension lines have a significantly higher incidence of cancer, particularly leukemia. Cancer is increasing on a world basis, and that's despite all the early detection. The percentage of deaths by cancer is increasing. Why?
でなぜでしょうか。
Well, this is the question he asked. So we start with nerve, because everything is fundamental to a nerve. How many of you have heard of Kirlian photography? Kirlian photography. Now what you can do, it doesn't take a picture, but it takes a picture of the electromagnetic field around your hand. In other words, it photographs the electromagnetic fields without photographing actual hand. I've had my hand photographed, so you can see all of the energy radiating out. And Bunny and I did some experiments with different foods. It's interesting to see how much more energy there is in a sprouted grain than there is in the grain before it's sprouted. One of the things that you get with raw foods, for instance, is that you're eating electricity. Living foods still have this radiation in them. So maybe we need that extra charge. We don't know about it yet. What Thelma Moss did at UCLA was to take the energy in a new flower or a new leaf. She cut one of the blades off of the leaf, and then she rephotographed the leaf. But the electrical field was still there, even though the leaf had been cut. In other words, there was an electric image that was that leaf. So maybe as our faces grow, there's an electric field out there that we are simply filling in. Grader did a very interesting study. He took some shavings of steel, like filings of metal. But then he made some magnets in the form of the dental pulp, and he made them in the form of a pulp chamber. Then he put the magnet underneath the plate. He tapped on the plate to reduce the friction of the sliding of the filings toward the magnet. The shavings then formed into the form of a tooth. He could change the form of the tooth by changing the form of the magnet. So maybe the tooth formation itself is from an electromagnetic field. But I saw him do it. I was in his home. He says, let me show you something. He's been a buddy of mine for all these years. I often said it's the greatest waste of a brilliant mind that I've ever seen in my history. He was the guy, the Brader arches, you know the Brader arches? Where he talked about the arch form being related to the base of the skull all the way back here. One of my very best friends since we were in school together at Illinois. He was in the class ahead of me at Illinois. He often tells everybody that he taught me everything I know. Because we had dinner together every night as long as he was there at school. He was the person that got me started in tomography. So I owe him a great debt. He proved the scientific accuracy of tomography. His work on tomography was published in 1948. Okay, now let's talk about muscle. When a limb moves, if I move my arm, you see visible motion. You see visible energy. You see mobility taking place. But that's only half the energy that's used. The other half of the energy is invisible because it is placing my arm in a position to where it can act. So in muscle action there is a mobilizing and a stabilizing component. One half the energy we use is invisible because we are using it opposing gravity. Alright, so muscles act to stabilize. Third principle. Now the next thing is that it's muscles that set all the limbs, including the mandible, in motion. So muscle has elasticity and contractility. Those are its two physical properties. Muscle then has the ability to be stretched and come back to its original length. Muscles in this sense are like big rubber bands. If I pull one direction and it's opposed by a pull in the other direction in the opposite direction. That is defined in physics as a couple. The mandible works as what we call a force couple system.
科学というのは我々
Now, where is it strongest? At rest position. It should have the greatest mechanical advantage at rest position because that's where it stays most of the time. In other words, you can bite hardest at the mouth opening of about 2 millimeters. And coming through a bolus, that's the range where most of the heavy chewing is. Number 9, all muscles are arranged in systems. When it works with another muscle, we say that it's facilitated by another muscle. There's also a term that I've heard more recently since I wrote this years ago, and that is that during an act of the mandible,
科学が何か作用するとき
in certain positions there is a recruitment of other muscles brought into play.
ある
These systems are called kinetic chains, and a muscle is not just isolated to one chain. It can work with several other muscles. The muscle works with what is called a motor unit. This is the nerve and the number of muscle fibers that are supplied by that nerve. That's a motor unit. The number of muscle fibers that one nerve stimulates is called its innervation ratio. In the eye, we have one nerve to every 5 muscle fibers. In the leg, it's 1 to 500. The eye needs to be very delicate in its action and controlled in its action. Muscles of mastication are 1 to 25 to 1 to 30. Now, the control comes with what Sherrington called the law of reciprocal innervation. I should say reciprocal inhibition. When a muscle on one side of a kinetic chain contracts, the muscles on the other side have to be inhibited. These factors on muscle are more important to us than you might think. Many class 2s are really not skeletal problems. Even those high convexity cases that I showed you were all treated non-extraction. So this suggests to us one thing, that we're not dealing in the majority of our cases with skeletal problems, in which the skeletal part is the part of the etiology. Certainly it is a factor. But if it is not the single cause of the etiology of a malocclusion, then what is the cause of a malocclusion? Muscle. Muscle function, or habits which alter muscle function. So when we diagnose a malocclusion, we have to diagnose muscle. When we treat a malocclusion, we're treating against the muscle. When we retain a case, we're retaining against a muscle. If spaces open up, we're treating against the tongue, which is a muscle. So, like it or not, we have to face up the fact that one of the very fundamental things that in orthodontics is a knowledge of muscle. And along with that then, as I have explained, is the nerve. And along with that, we know that we can inherit motor patterns.